my name is Dr. Lotta. Nice to meet you. I will be your doctor today. Yes. So, could you please tell me your name and your date of birth? Mm-hmm. And now I also need the data from your insurance, if you are insured. Yes, okay. I see your file. So you're here for the obvious head injury, yes? Okay. So please tell me how that head injury happened. So a fall, okay? Yes. So for this head injury, I would like to first check your pupils. So just look straight at me, and yeah, they look to be the same size. And I'm just going to check if they constrict, if both of them constrict. So I'm gonna apologize. So keep looking at me. Okay. Yeah, I'm just shining the light into this eye, but looking at that one to see if both of them constrict. Okay, the other side. Okay, that looks good. So, there doesn't appear to be any injury to the brain as of now. On a scale of 1 to 10, what would you rate the pain? Okay, so I'm going to put some gloves on and inspect the wound, and then we'll see what kind of treatment is the best for this kind of wound. Yes. Are you nauseous or dizzy? Generally feeling unwell? Headache? Okay. So, did you do anything to the wound yet? Clean it with water, disinfecting it? Just a little water. Alright. So I'm just gonna take the flashlight again. And don't worry, I'm being extra careful. And if anything hurts, just tell me. Okay. So, yeah. Did you see any splinters, any dirt, anything that's not supposed to be in a wound? Okay, so you didn't take anything out. Good. Yeah, I'm not seeing anything either. So, wound seems to be relatively superficial and clean, so there's no dirt inside, there are no splinters, no foreign objects. Yeah, does this hurt? A little bit? Okay. Yeah, the wound doesn't seem too deep, so I'm going to disinfect it, and then I'm going to put some steri strips over the wound. Don't worry, I'm going to tell you what they are in a minute. And I think that will be it. still, please. And I'm going to tap this on the wound. By the way, you should never use cotton balls because some little tiny pieces of cotton can get stuck in the wound. Always go to a doctor, and the doctor will use sterile fabric or sterile strips. Okay. These are sterile strips, and I'm just going to put them on the wound, just like that. They will stay on for about 2 weeks. You can shower with them, and just don't rub them with the towel, and they will fall off on their own. If the wound was any deeper, I would have stitched it, but for this kind of wound, sterile strips will be enough. So I'll still just gonna. Okay. Third one. Just okay. And to protect the wound from any further dirt, I'm gonna put Band-Aid over it. Yeah. Okay. Okay. Now, do you have any other symptoms? We've already ruled out dizziness, nausea, and a headache. But how's your balance? Are you experiencing anything unusual regarding sense of smell, hearing, eyes, face, anything that feels unusual? Okay, I'm going to write this down. Okay, well, in that case, I would like to perform a cranial nerve exam on you. Do you know what that is? No problem. So, the cranial nerves are the nerves in the back of your brain. There are 12 cranial nerves, and they are responsible for everything going on in your face. So, they are the ones that make you able to smell, hear, see, taste, move your face. There are lots of different things they do. And in a cranial nerve exam, we test the nerves by testing the different regions. Yes. The first thing we are going to test is your sense of smell. So I've got these little smell tubes. I'm going to hold one nostril closed and then hold this under your other nostril, and you will tell me what the smell is. lila, correct. Now I have a different one. And I'm gonna hold your other nostril closed. Toothpaste, yeah, it's mint, so yeah. Okay. Yes, so your sense of smell seems to be working. Good. That's very good. Next is your optic nerve, so I'm gonna inspect your eyes again. Look at me. Okay, please look a little bit to the side. Just gonna shine this in your eye. Okay. Now, see this chart? Okay. I'm going to hold one of your eyes closed, and then I'm going to ask you to read the lowest line that you can still see. So let's start with this eye. Yes. Lowest line. Yeah, that's correct. Now the other side. Oh wait, I can't even see it. So, there we go. And the lowest line. Okay. Okay. Yeah. Yeah, you got all of them right. Great. Okay, now I'm gonna use this pen as a target. And I'm gonna ask you to follow this target with your eyes without moving your head. Okay, so I'm gonna start here. So keep following. Okay, and now keep your eyes on the target. Keep your eyes. Keep them on the target. Okay. Okay. Now I'm gonna wiggle both my fingers from the sides, and you're gonna tell me when my fingers appear on your field of vision. So, and again. Okay, and I'm also gonna do this way. So, okay. Now I'm gonna hold them up, and you're gonna tell me which finger wiggles. Okay. So. Yeah. Yeah, it's getting a little bit more difficult. Okay. Very good, both of them. And the last thing is a quick color test. Are you colorblind, or do you have any problems with color in general? please tell me what this color is? Yellow, that's right. And then what this color is? Pink, yeah. What about this one? Green, good. And the last one? Blue, very good. Next, the target makes a reappearance, and I'm gonna use this to test the nerves that are responsible for touch and feeling touch. So as you can see, this one has a soft side and a pointy side. You can feel that it's not pointy at all. Just a little more pointy. Yeah. So I'm gonna ask you to close your eyes in a minute, and then I'm gonna touch you with one of the two sides. I want you to tell me which side it is. So soft or sharp. Okay, close your eyes. Soft. Soft. Sharp. Soft. Sharp. Soft. Soft. Sharp. Soft. Soft again, yes. Sharp. Okay, brilliant. You can open your eyes again. You got all of them correct. Next on our list is your facial nerve. So I'm gonna ask you to make a lot of facial expressions, and I will see if both sides do them equally and if everything looks as it should. Yes. So first I want you to frown. Yeah, just pull your eyebrows together. Yes. Great. Then I want to raise your eyebrows. Yes, raise them. Okay, yeah. Now please blow up your cheeks like a pufferfish. And now smile. Yeah, you can do it with or without teeth. Okay, great. Your hearing is the next, so I'm just gonna go to your ears, whisper numbers in them, and you will tell me what numbers they were. Okay, just between 1 or 10. Okay, so this side first. So 2. Other side. 7. 4. 8. 8, correct. Now, please close your eyes again. I'm going to do this besides one of your ears. And you're going to tell me which side it's on. So, close your eyes. Correct. That's right. Good. Now I'm going to do both at the same time, and I want you to tell me if one of them is louder than the other. Equal? Good. Now, I'm gonna ask you to open open your mouth and say, ah, okay? Yeah, so open up. Everything looks good. Great. Okay, next I'm gonna test your range of motion and strength in your jaw. First, I'm gonna ask you to please stick out your tongue as far as you can. Yeah, further. Good. And now wiggle it from side to side. Yeah, just. Good. Now, please push against your cheek with your tongue, and I'm gonna push back to test your strength. So, okay, let's do this side first. This side. Then I'm gonna ask you to shrug your shoulders, also while resisting my hands. I'm gonna push your shoulders down, and you're gonna push them up. Got it? Good. So push them up. Push them up. Yeah. Okay. And then move your head from side to side, and again I'm gonna push again. Okay. Yeah. Keep pushing. Keep pushing. Okay. Okay. Yes. So that seems to be. So that concludes the exam. Everything seems to be alright. I could not find anything that was out of the norm. Hopefully the headache will subside in a day or two. Make sure to change the band-aid every day, after a shower, for example. But do not pull the steri strips off, they will fall off on their own. Yes. I'm gonna let you go home. I'm not gonna keep you here in the hospital. If anything changes, if you experience any new symptoms or if your symptoms get worse, please go see a doctor immediately. Yes. Okay. It was nice meeting you. Well, get well soon. Bye bye.